you've tuned in to a brand new edition of Health 360. On the show today, new research that gives us an indication that Parkinson's disease starts with the gut and not with the brain. Also on the show, colon cancer cases increasing in young Indians, also in youngsters outside of India, particularly America. What's really going on here? We're also going to be telling you about how you're aging, not over a period of time, but in two bursts. Once you turn 44 and then again when you turn 60. What does this do then for us? What does this indicate? How can we prepare for aging? India has also seen an increase in cases of dengue, also dengue deaths, Mpox cases as well as cases of Nipah in Kerala. We're going to be telling you about that and many more the trending big stories from the world of health and wellness. I'm Sneha Mordani. This is Health 360. Do you suddenly feel that you're getting wrinkles? Your metabolism has slowed down, your aches and pains have worsened. Do you feel that suddenly you are becoming old? You could be right, because aging is actually not a process. But research says that it comes in two bursts. So if you're 44 and you think that you are suddenly becoming old, you could be correct. Research indicates that aging happens once you turn 44 and the second time it peaks when you turn 60. Essentially, this new research gives us an indication about what can you do then to help yourself. How to prepare yourself for this time period before you actually hit the peak of aging. This report gives you an understanding. Aging is inevitable. What is born, what lives, what eats, what survives will always grow old. Growing old is mandatory. We all think we are aging over a period of time. But is that so? A sudden accumulation of wrinkles, aches and pains, your joints hurt, your metabolism has become slow. You have no stamina. All of that is signs of aging. But do you know that you actually do not age over a period of time? It actually happens in two bursts. Once when you turn 44, the second time when you turn 60. And there is solid research to back this. A study now shows that you do not age over a period of time, but it actually happens in two bursts. One when you turn 44, the second time when you turn 60. So how was the study done? Essentially, 108 volunteers between the ages of 25 to 75 were tracked over a period of time. The molecular changes in these volunteers were tracked. They submitted their stool samples, their skin swabs, their throat swabs, their nasal swabs, essentially whatever they could to give the researchers a sense of how quickly these change over a period of time. The molecular transition actually did not happen over a period of time. It happened when the person turned 44 and the second time when the person turned 60. Most of the abundant molecules did not transition or change over a period of time. There were dramatic changes when the person turned 44 and 60, hence indicating that aging actually peaks during these two time periods. The mid-40s spike was actually expected in women who hit perimenopause around that point in time, around that age. But what about men? The researchers were surprised to find that even men actually are aging, similar to women in their mid-40s. Essentially, this is what was seen. Reduction in metabolic rates, stamina loss, aches and pains, cardiovascular problems around the time the person turned 40 or 44. What became evident is that in their 40s, the real problem actually starts when the muscle mass reduces, when the recovery time increases gradually, and the problems continue to arise. Also, the researchers importantly found that those with sedentary lifestyles are the ones facing these problems maximum when they hit around 44. Aging is inevitable. That's what the research says, and many experts agree. For example, some experts talk about the fact that no skin cream or no machine can really stop the wrinkles from appearing on your face. What you can do, and what this research really is focusing on, is how you can prepare your body, knowing very well that you are going to be aging. And the time is also indicated. Prepare your body before you hit the age of 40. As cliche as this may sound, but not consuming alcohol, not smoking, exercising, lifting weights is absolutely essential. The right kind of food to prepare your body for what is inevitable. And when you're turning 60, a good idea to have preventive healthcare checkups so that you have an exact indication of what could be possibly the problems that you could be facing in the next few years of your life. And prevention, clearly, as we know, is better than cure. So preventing all of these problems, age-related problems, at an early stage would then be the key. Now, the idea is to not have band-aid solutions, but work on yourselves while you are healthy. That's what all experts agree on.
There are more than 100 types of anti-aging creams that I know by heart. And out of those 100, sorry to say, but at least 40 of them maybe work a little bit, and 20 actually work a little. 5 I'm convinced with. The rest do not work. So it's not that just applying a retinol or a fruit acid or a lactic acid is actually going to make you anti-age. That's a fact you need to understand. You need to use products according to your skin. You need to exfoliate for 2 days. You need to nourish it for 2 days. Even if you have an oily skin, you need to hydrate the skin for a few days. You need to use some sort of a gel which would contain hyaluronic acid or a similar sugar molecule which is binding enough for the skin cells so as to make the skin hydrated and not let it dry.
So our natural aging process, 2 things happen. One is sarcopenia, which is essentially the loss of lean muscle mass, and osteopenia, which is losing bone density. The good news is that by regular resistance training, you can combat both of these things. You can preserve your muscle mass and you can promote bone density by just training 2 to 3 days per week.
Colon cancer or colorectal cancer, which is in fact the cancer of the large intestine and the rectum, is usually seen in people above the age of 50. What's happening over a period of years, and this is applicable to Indians as well, is that younger Indians are developing colon cancer between the ages of 31 to 40. So what is going on here? What about our lifestyles? What about alcohol consumption, smoking, consumption of heavy-duty processed foods? Has this got a link with increasing cases of colon cancer being seen in young Indians and also in youngsters around the world, particularly the United States of America, where the consumption of processed foods is extremely high? Here's more.
Red meat is very significantly, it has been found to be increasing the incidence of colon cancer.
If you have a terrible lifestyle, drinking, smoking, not exercising, not consuming the right kind of fibrous foods, consuming excessive ultra-processed foods, then you're in for serious trouble. Until a few years ago, colon cancer was a cancer seen in the aging population, those above the age of 50. But times have changed and so have things. A growing number of younger Indians are being diagnosed with colon cancer. Colon cancer, also known as colorectal cancer, is a growth of cells that begins in part of the large intestine called the colon. It's a disease caused by DNA mutations in colon or rectal cells. It begins with small, non-cancerous clumps of cells called adenomatous polyps. Over time, some of these polyps can develop into colon cancer. However, not all individuals with polyps develop cancer.
Gradually, younger Indians are especially shifting more towards junk food, high-fat diets, westernized diets, more processed diets. So that is where the incidence is increasing in our population, and that too in more younger patients we're having these. And especially processed meat or red meat are a significant contributory factor.
A study shows that over 200 million Indians get in no physical activity. Nearly 1 in 5 parents believe their child should prioritize studies over physical activity. 48% of older adults believe that they are too old to play a sport or exercise. 45% believe that girls will bring bodily harm to themselves if they play a sport. And this will impact marriage prospects. The Delhi State Cancer Institute has found that people between the ages of 31 to 40 are increasingly developing colon cancer, a worrying indication.
Well, you see, in India, we are experiencing a huge amount, a surge in the increase in the number of cancers overall, and colon cancer turns out to be at the number 4th, if we see both males and the females. And especially our younger age group, which is 31 to 40 years, it is more prone, they are more prone to land up with the colon cancer. The various factors like, our dietary modification has become so, so much so that we are ordering foods, we are having foods which are processed food, and the dependency on the red meat. All these factors, along with the sedentary lifestyles where most of us are having a laid-back job, we are sitting, not able to exercise thoroughly throughout the week. Followed by that, you have obesity, which is rampant in India. And obesity itself causes so many cancers, and out of that, one is colon cancer.
The key, experts say, is an early diagnosis and routine screening, which is now an absolute imperative.
Patients who are having symptoms such as altered bowel habit for a prolonged period of time, bleeding in the stool, fall in hemoglobin, or those that constitute high-risk groups such as family history of colon cancer, or with inflammatory bowel disease, or a past history of having had what are called precursors to a cancer, that is polyps in the colon. These are patients who should be considered for early colonoscopy.
The concern is the stigma around colon cancer.
Colonoscopy is a test which is now widely available. Most medium and large size hospitals will have the facility of colonoscopy that is available. It can be done under both sedation and even as an outpatient procedure without sedation. It is safe. The risk and complication rates are extremely low. Therefore, with this wide availability, the threshold to do a colonoscopy in patients who need it should be low.
So how expensive are these tests and how are they done?
Test for diagnosis of colon cancer is extremely simple. It requires the intestines first to be prepared. By that we mean that they need to be cleaned out by giving a medicine where patient has a few loose stools and the intestine becomes clean enough that the visualization during colonoscopy can be good. Subsequently, as I mentioned, the patient can undergo the test either as an outpatient procedure. Sometimes those patients who are more apprehensive may want sedation, which can also be given to make the test even more comfortable.
The good news is that colon cancer is highly treatable, especially when it is localized to the bowel. It can cause symptoms like rectal bleeding, changes in bowel habits, and abdominal pain. It might just spread to other organs if untreated.
The early signs to detect colon cancer, the number one is blood in the stool. So often in India, most patients confuse it with piles or hemorrhoids and they just ignore it. And once they come to us, it's already been spread to a lot of other organs. Never ignore any blood in your stool. Report to your nearest physician. That is the number one point, and the message should be loud and clear in this. The problem with the colon cancer of the right side is that the patients generally don't land up with the symptoms early because right side colon tumors have space to grow, whereas left sided your symptoms will come up early in the form of blood, and in the right side you can have excess amount of diarrhea or any altered bowel habits.
Let's now bust the myths around colon cancer. Many people believe that colonoscopies are not safe.
No, I think it's absolutely a myth that colonoscopies are absolutely safe. In fact, in the West, since the incidence of colon cancer is high, colonoscopy is advised as a protocol after 50 years for everybody, because it's a good screening exercise. But colonoscopy is absolutely safe. The incidence of complications is very low, less than 1%.
A colonoscopy is the only screening option for colorectal cancer, is what many believe.
There are other tests available. Most of the colon cancers occur in part of the colon that is distal, meaning in the distal colon and the rectum. A simpler form of an endoscopic procedure, which is referred to as a sigmoidoscopy, which takes lesser time and visualizes a limited part of the large intestine, may be done. There are also now upcoming blood tests which are available. However, it would probably be correct to say that colonoscopy is the best test available for screening of colon cancer.
Abdominal pain and bleeding are common symptoms of colorectal cancer, the most prominent ones.
In order for a cancer to become 1 centimeter, it has to take at least 10 raised to power 9 billion cells to be there. Just see how billion cells are able to make 1 centimeter, and our screening methods starts to detect them at the level of 1 centimeter. So cancer is a slow growing process. It's like a parasite, or it's like a termite which is slowly creepingly, it starts to eat away your body. Another point, sometimes why colon cancer is missed, because of the location. Right-sided tumor, they have more space to grow as compared to the left-sided tumor. So the sidedness also plays an important role.
A rectal cancer diagnosis means a major surgery, is what many people erroneously believe.
10-15 years back, our main modality was surgery. Every patient who was going to have a rectal cancer or a colon cancer, everybody, we were offering them surgical options. But now the treatment guidelines have entirely changed. We are hovering into the zone of immunotherapy, radiation therapy. We have select subgroup of patient. If we get an immunotherapy positive marker, we will just give them immunotherapy, and only for 4 to 6 cycles. That is it. The role of radiation is more in rectal cancers, where locally advanced rectal cancers are being treated in the form of chemotherapy, radiotherapy, concurrent, followed by surgery, and then followed by again chemotherapy. Whereas for colon cancers, we are if it is an early stage and our surgeon feels it's resectable, we are offering them resection upfront and followed by chemotherapy.
September is recognized as the Prostate Cancer Awareness Month, a time dedicated to raising awareness about one of the most common cancers affecting men worldwide. Prostate cancer, which develops in the prostate gland, primarily affects older men, but younger men with a family history are also at risk. This month focuses on educating the public about the risk factor symptoms and the critical importance of early detection.
Early detection in prostate cancer is done through a single test called PSA screening. PSA stands for prostate specific antigen. It is not prostate cancer specific. The results have to be interpreted by a trained urologist and not any other person. The reason I emphasize on this is by the age of 50, most men should have at least one PSA test, so that if there is any elevation, that patient can be screened for prostate cancer by regular PSA testing every 2 years. If there is a family history of prostate cancer, we might start PSA screening by the age of 45 to 50.
The national capital is witnessing an increase in the number of dengue cases, with the city reporting 2 deaths due to the vector-borne disease in the last few days or so. Hospitals across the city are seeing a surge in the number of dengue-related admissions. At the capital's Safdarjung Hospital, in the last 24 hours, 13 dengue cases were reported. This comes as the city witnessed over 1,000 millimeter of rainfall this year, which is the second highest in the last 10 decades.
Dengue is basically a viral disease which is transmitted by mosquito bite. It behaves like a viral illness where you have high-grade fever, body ache, headache. If it is ignored or neglected and people are not hydrating themselves well, then we can get into complications of dengue, the most severe being dengue hemorrhagic shock or a dengue shock syndrome. The body fluid leaks and you have got low blood pressure along with low platelet counts. This is a serious condition, and if this is not handled in a hospital setting seriously, then we can even lose a patient.
Nipah and Mpox in Kerala. The Kerala government has imposed restrictions at containment zones in Malappuram, where a 24-year-old recently died due to Nipah infection. Nipah outbreaks have been reported in the past as well, in Kozhikode in 2018, in 2021 and in 2023 in Ernakulam district in 2019. The presence of Nipah virus antibodies has been detected in bats in Kozhikode, in Wayanad, Idukki, Malappuram and Ernakulam districts. A man who travelled from the UAE to Kerala last week has been hospitalized after he developed symptoms of Mpox as well.
Nipah virus is a viral infection. Basically, again, it's a zoonotic disease. That means it is transmitted from animals to human beings. The most common animals are pigs, bats and all that. The mortality can be as high as 40 to 75% if not managed well. Unfortunately, there are no definite treatments, modalities available for that, and only there are symptomatic treatments available. See, monkeypox is obviously something which has come from African countries. If you have rashes, which is typical of monkeypox, or if you have lymph node or the gland enlargement, they are more typical in this disease. Once you have a history of travel or history of contact with similar people, then you have to suspect monkeypox.
Well, if you want to minimize the risk of winter bugs, then now is the time to gear up to fight them, to fight flu and pneumonia. And this is not just seasonal inconvenience. They can lead to severe complications, particularly in the vulnerable population, such as the elderly, children and those with underlying healthcare conditions. That's why getting vaccinated is important to build your immunity shield.
Flu shots do prevent flu, that is influenza. The recommendation normally was that they should be taken before October every year. Now, who should take it? Less than 5 years of age, but more than 6 months of age. Anybody above 65 years of age should also take influenza vaccine. But if you are less than 65 years of age but suffer from comorbidities like diabetes, heart disease, kidney disease, then you are also a candidate for influenza vaccine at a lesser age than 65.
Research indicates that those who develop Parkinson's disease are surely to have gut problems. 76% of them have gut problems as well. There is a deep link between your gut and your brain in terms of diagnosis of Parkinson's or Parkinson's plus. I explore in this report. A disease linked to your brain has found a direct link now to your gut. A recent study has concluded that Parkinson's may have origins in the digestive system rather than the brain. Gastrointestinal problems could heighten Parkinson's disease risk by 76%, is what a study has found. It's been published in JAMA Network Open, and it adds to a growing body of evidence that aging-related or neurodegenerative diseases, long thought to originate in the brain, could begin in the gut.
GI manifestations present far earlier as compared to the motor manifestations, which may include dyspepsia, nausea, vomiting, gastroparesis, which results in chronic constipation. Patients are so deterred and bothered by constipation that sometimes this turns out to be a major facet in their ailment, and it is often very difficult to get rid of, because there are medications of Parkinson which will simultaneously even potentiate more constipation.
Gastrointestinal problems are known to be common in patients suffering from neurodegenerative disorders. The study has found that digestive issues can involve constipation, drooling, difficulty in swallowing and delayed emptying of the stomach. These are in fact strong risk factors related with the more than doubling of Parkinson's disease risk.
There are recent studies which are telling us that there are some risk factors which lead to Parkinson at later life, and these could be non-motor symptoms of Parkinson's like constipation and difficulty swallowing and all. So the reason they have suggested for these kind of findings are involvement of autonomic nervous system, which is responsible for our gut movement. Constipation and swallowing difficulty could be prevented only by prevention. There is no cure for it. There you can go for some lifestyle modification. You go for high fiber diet, go for hydration, exercise, avoid cigarettes, alcohol, smoking and all, and go for medication if there is more severe symptoms.
The findings of the study have important implications for the early detection and treatment of Parkinson's disease. By identifying individuals at risk based on gastrointestinal systems, doctors may be able to intervene earlier and potentially delay or prevent the onset of motor symptoms. Previous research has found that people with Parkinson's disease also experience changes in their microbiome long before other symptoms appear. This neurodegenerative disease impacts almost 10 million people globally, who can at best hope for therapies that slow and alleviate symptoms. Symptoms that begin with constipation and sleep problems up to 20 years before progressing into dementia and the debilitating loss of muscle control. All right, that brings us to the end of this edition of Health 360. We hope you enjoyed watching the show as much as we did, putting it together for you. You can find these reports and much more on health, wellness and fitness up on India Today's social media platform. That's Twitter, Instagram, YouTube and Facebook. Also, on India Today's website, that's indiatoday.in, you can always download the India Today app as well. Until next time, take very good for yourself. Bye for now.